A new trend in medicine is becoming more popular, where patients pay a monthly fee to their doctors. It is called direct primary care.
Many patients say it means more attention and better care. Only on 6, I talked to a Green Country doctor and a patient who both made the switch. When the Affordable Care Act passed, and after about 3 decades of practicing medicine, Dr. Chris Armstrong realized he needed to do things differently.
I just couldn't work any harder. I was working 8 hours a day, plus coming in 2 hours early to do paperwork and staying 2 hours later in the day to do paperwork, and sometimes even come in on the weekend just to do paperwork.
So Armstrong turned his practice into a concierge practice. In his case, Armstrong still accepts insurance, but his patients pay a monthly subscription. Patients like Tim Afeld.
So are you having any problems today?
No, actually I'm feeling pretty good.
Afeld and his wife weren't sure about spending the extra money on top of what they already pay for insurance, but decided to try it for a year.
The outcome and the benefits of it was so overwhelming that it was like, I'm glad we did it. This is something we need to do every year.
For Dr. Armstrong, subscription fees help pay the overhead of running a practice, meaning he doesn't have to see as many patients each day.
That's the model that right now that we're caught in modern day medicine, is you have to see 20 to 30 patients a day to make a living.
Instead, he now sees about 10 each day. He used to treat about 3,000 patients a year. Now it's about 300. Fewer patients means they get in much faster.
The waiting time is nominal. I tell everybody, if you have to wait 10 minutes to see me, it's been a bad day.
And fewer patients also means Armstrong is able to spend a lot more time with each one.
We do physical lab work, physical tests that regular medicine can't do. They can do it, but insurance doesn't pay for it, so consequently physicians don't do it.
Of course, it depends on your doctor, but Dr. Armstrong's patients pay $900 a year if they're 39 and under. 40 and older pay $1,650 each year.
Can you take a deep breath for me? Breathe it out.
3 years later, Afeld says the added cost has been worth it.
You have to sit down and look at it because it is an investment, but it's a wise investment because it's in your own health.
I will tell you that I'm making less with this model, but I find myself happier because I'm really making an impact on people's lives.
Okay, so if you're a patient, why pay more each month? Well, seeing fewer patients means Dr. Armstrong can focus more on prevention instead of just treating symptoms when someone is sick. He says he's seen improvements in things like diabetes and high blood pressure, and ultimately, if people are healthier over time, they're going to save money on their health care. Now, critics of this kind of care worry that the growing trend will mean the current shortage of primary care doctors nationwide is going to grow, since doctors under this plan would see fewer patients.
It's a quandary, isn't it?
Well, it definitely opens your eyes to a different way of doing things. And of course, who wouldn't like less time in the waiting room and more time with the doctor?
And more time with your doctor.
Yeah.
I know, it's very interesting.
The hope is basically catching things early and doing so much preventative stuff that the short-term costs will be offset by long-term savings.
Instead of just treating those symptoms. All right, thank you.